cancer can use glucose. It ferments glucose. It also is capable of fermenting an amino acid called glutamine. It breaks it down and it feeds it right into that same metabolic energy cycle called the Krebs cycle, and it can ferment it. In fact, with cancer, we do something called a PET scan, and PET scans are what they do is they inject FDG, fluorodeoxyglucose, which is a radioactive glucose, and then what they do is wait about an hour, and then they scan you, and they see wherever there's a rapid uptake of glucose. Depending on how rapid it is, they can determine the aggressiveness or the strength of the cancer. Okay, because cancer is picking up glucose at a really high rate relative to a normal cell, really high, because it needs it. Remember, we talked about that. So now, some cancers don't show up on PET scan. Why? Because they're fermenting glutamine. They prefer glutamine to glucose. So glutamine. Now, there's no way to get glutamine out of your diet. So you can do a ketogenic diet and you're going to get most of the cancers that are glucose fermenters, but you won't be touching those that are a glutamine fermenter. And so, how do you deal with that? Well, there's one glutamine blocker that's available as a drug and very difficult to get, but it's fantastic if you can get it. But what's the other way? How do you keep glutamine and the glucose out of your diet? Again, H2O, water. Water would be the absolute way to do that. But 70% approximately of people who are on a ketogenic diet, a strict cancer ketogenic diet, 70% the tumors will shrink. 30% they won't. About. Well, these are not exact numbers, about. If you block the glutamine as well as the glucose, 100%. Why 100%? Because there's zero fuel for the cancer. Zero fuel, it cannot. Zero fuel to a fire, the fire goes out. Zero fuel to anything and it dies. Okay, so this is just common sense. Okay, that's why water fasting is the ultimate, but not, as I said, not everybody can or wants to do it, or is willing to do it. Okay, and it takes a lot to do it. But those that want to, it's wonderful. And it really depends on many things. You can't just decide to do this. You have to have guidance. You have to have medical guidance by a doctor who knows what they're doing. You can't ask a doctor who's never supervised it, who's never understood it. But again, there are places that you can actually get a supervised water fast, like in California, a place called True North. And there are others, and they're outside of the country as well, where they can actually supervise it. Because you need to know what you're doing with it, especially if you have cancer, okay? Because you can't just do this on your own. Although people do. But I'm just telling you to make sure you don't make mistakes, because it's showtime, no rehearsals here. Let's make sure we do it right the first time. So that's what I would recommend, is that you have good, experienced medical guidance. Now, so in order to get to the state we were talking about, what the research is showing is that if the glucose to ketone ratio is less than 1.0, then you are really, in other words, that means there's more ketones than glucose. So that means the body there's not enough glucose at all for cancer, and it will shrink down. And this has been shown to occur even in one of the most aggressive and difficult to fight cancers that we know of, called glioblastoma multiforme, GBM, glioblastoma. These are primary brain tumors. Very, very difficult to fight. They come back. You cut them out, they come back. You burn them with radiation, they come back. They're like, they remind me of a fungus. They just keep growing. They have tentacles and they go, ketogenic diet, they go away. They die because you're starving them. It's really quite wonderful. So, but you've got to keep that. Now you have to remember too that we have to look at caloric intake as well, because calories, in terms of Fat. Well, the ratio that we like to see, some people have a keto, they have 90% fat and 10% proteins. What we're used is 80% fat, 15% protein, and 5% carbs. But what you have to keep in mind too is that protein, when you've exceeded your protein requirements, remember, we don't have just like if we exceed our carbohydrate requirement, like I'm getting more glucose than I need, my body turns glucose into fat and it gets stored. There's no way to store protein. Protein doesn't get stored. But excess protein goes through the liver and gets turned into glucose, which gets stored as fat. Okay? So that's the same thing. Fat is fat. Fat is fat. Fat doesn't become glucose. Fat is fat. So you have to be careful with the amount of fat and protein. Okay? The way we do that is that we give everybody a way to monitor their fingers, and you have to take control. Why do you have to take control? Because what is one of the worst parts of having cancer? You can ask anybody with cancer. One of the worst parts of things about cancer is that you lose control of your life. You lose control. And I'm not going to even go into the philosophical discussion about whether or not anybody really has control over anything. Let's assume that we all have control over our lives. We have control over what we're doing. When you have cancer, you don't. Now, whatever your agenda was becomes irrelevant because you've got to go to this doctor, you've got to go to this doctor, you've got to sit in this room and get IVs, and you've got to do this, and you no longer have any control. Okay? So, if you can master the ketogenic diet, you get back control because you will starve the cancer. Okay? And so if you do that, so the way we do it is, the way we're doing it in Thailand and the way we're doing it in the US now, is you get very strict ketosis, you have the glucose to ketone index or ratio less than 1.0, 0.6, 0.8, 0.9, whatever, for 6 weeks. Now that doesn't mean the day you start your ketogenic diet, because it takes about 5 to 7 days of a ketogenic diet to get into a state of therapeutic ketosis. Okay? So what I'm talking about is the time from the moment you get into therapeutic ketosis, which is less than 1.0. So the fastest way to do that, of course, is if you come in and you do a cleanse, let's say a juice fast, of delicious, wonderful juice with some apple and lemon, and it tastes good, you enjoy it. Or a master detox, which is another kind of fast. If you're doing these things, then you're going to go into the ketogenic diet. And once you've done the cleanse long enough, because you need to cleanse, we can go in that at another time, you can do the transition. You do a 2 to 3 day water fast, and you will go into ketosis immediately. So that when you start the ketogenic diet, you're already in ketosis. You're already in therapeutic ketosis. That's what we want to get you to. Okay? So then 6 weeks of therapeutic ketosis, then 12 weeks of just a good healthy diet, fun diet, but healthy. Then 6 weeks of ketogenic, 12, 6, 12, 6, 12. And that way you have developed a system of food that you love to eat during the ketogenic portion. You know how to monitor it. How often do you monitor it? Every day. Every morning you wake up, you might even, in the beginning when you're working out, what keeps you, why did my ketones weren't high today? Why was my glucose load or higher than it should have been today? You've got to keep a food diary and check your morning and evening, and just try to see where you're at and try to figure out what's happening in your body. Okay? So it's something you control. So now once you've developed all the recipes, you use our recipes, and then you can modify them and add to them. Once you learn how to make a diet, there's actually an app you can get on your phone to help you make a diet that's going to keep you within the parameters that you need to be to maintain the proper ketone and glucose level in your blood. So once you learn how to do this, you take back control. It's now in your... So now let's say the cancer is gone. You have a clean PET scan. You've gone through all the therapies. And you go back home. And if you're doing the 6 weeks keto, 12 weeks healthy, 6 weeks keto, it's not going to come back. And if you start to see like whatever, a rise in your tumor markers or anything, extend it. Do an 8-week ketogenic diet. Add in a few days of water. You know, we can talk about the way to augment this, but I mean, you can just absolutely keep it under control. It gives you back the control that you deserve, which is your life. You deserve the control over your life, and you know, you don't want to have to go visit somebody with a white coat on who you never met before and tell you what to do and take away your power. It's your health, is yours. It's not his. Okay? And eventually, remember, you're the one that has to walk the path. Nobody's going to walk your path. You can't get someone to walk your path. You have to walk your path. So in order to walk your path, you got to know what your path is and understand it and then walk it. Okay? And the real job of a doctor is not to prescribe anything. It's not to prescribe drugs. The real job of a doctor is to teach the person how not to be sick. That's our job. That's what doctor means. Let me teach you how not to be sick. You can get technicians to figure out that. You go to a good computer system, they're going to give you a better diagnosis. They're going to give you all the possible drugs you could take. You can all much smarter than any human. The job of the doctor is to teach and inspire. That's what the job is. And all healthcare practitioners should be doing the same thing, teaching and inspiring. Okay? And you remember, you can't teach and inspire anybody unless you live it. So anyway, so that's the ratio you want to have if you have cancer. And you can't do it for more than 6 weeks because it doesn't have all the nutrients. You know, it's not a sustainable situation. It's something you can only do. 6 weeks, 8 weeks.